We're speaking with Monica Doherty, CEO and founder of a new internet company called Tours International. Monica, why did you begin Tours International?
Actually, Jeannie, it started out with my needing surgery myself. I was one of those people that were looking for options to have surgery done because my insurance would not cover it or most of it, and it left me with a large amount of money that I would have had to come up with and couldn't. I was lucky enough to see a segment on 60 Minutes about medical tourism, which talked about companies that put people and hospitals abroad together and help them, facilitate going over there from beginning, helping them with the airfare, helping them selecting the doctors, helping them with where they stay in afterwards, and having assistance the whole way around. And I went for some medical tourism company, and there I really saw the need to help people. The important thing was for me that I know that people here in the United States, that there are thousands of people in need of procedures like this. They might need heart surgery, they might have cancer, they might need some kind of procedure that is not approved in the United States, and they have explored all the options. And I see this as a very needed thing. I just want to mention to you that I just recently read an article in ARC about a man who had just lost his wife to cancer, was left with $270,000 worth of medical debt he had to pay, and now was diagnosed with cancer himself. And when he went to the hospital, he was told, this is a $30,000 procedure, we will need $20,000 up front. This is something, according to ARC, who done some research evidently on this is a fairly common practice of hospitals to ask you for money up front. It's not like you're going to have your procedure and you can pay it off. They want it up front. And what's more is what I find most appalling is that if you are diagnosed with cancer and you seek medical help, if you don't have the financial means, you are not going to get treated. Mm-hmm. If the hospital only has to admit you if you're acutely ill. So if you don't have any money, what
Which
are
is
your
the
options?
case with so many people.
It's not people that are poor. It's the middle class people who do have. They might have a home. They might, they're working. They have the means, but they don't have. It would wipe them out completely, leave them destitute, and or at least wipe out all their savings. So that's really what the impetus was behind it, that I thought this is something that I would like to also do, and that because I now have had the surgery, I've been a patient myself, I can help, I can talk to people about what it's like to have that done. And so, yeah, it's about helping people, really.
Monica, there are a lot of these places on the internet I see as I surf through. What makes Tours International special and different?
I could say because we really care about people. And that sounds like, I'm sure that everyone says that, but really all of our staff, Jeannie, that works with us has been working in the human services field, all in the helping professions. And when you're working in the helping profession, you really don't do it for the money, as you know, I'm sure. You really do it because you care about people. And so that's really the big thing about us. We really truly want to help people get help. The other thing is that a number of our staff has had surgery abroad themselves, so they're really coming from the patient perspective. They have been through it. They know what it feels like. They know what it feels like to be in a foreign hospital and recover. They know what the needs are. And the difference is that we're not a travel agency. We have travel experience. We have 7 years of travel experience running a travel agency, but we're not a travel agency. And in fact, if people want to arrange for their own flights, that's fine with us. They want to use their frequent flyer miles, that's perfectly okay with us. We are more than happy to help them put all of that together, but our main focus is of selecting the doctors, helping them select the doctors, I should say, putting them together with the kind of hospitals that are really up to par, that meet the standards that people are used to here in the U.S. And for that reason, we tour the hospital. We try to make visits there every 4 months or so, 4 to 5 months, and make sure that all the hospitals are still that they're maintaining the way they need to be. And so we hand select our hospital partners. One of the things that we found when we did a little research with other companies is that they tend to send people to the same hospital. And some of them have arrangements where the more patients they send, the less they get some discounts of procedures, and they're also going to get more money. And that's perfectly okay. We do have to earn an income. But what is not okay with me is to send people to a hospital because because this is where you're going to get the lesser procedure, because the less costly procedure, because it should not be just about not paying what you have to pay, because we are not talking differences of thousands and thousands of dollars. We're talking about the procedure might be less, a couple of thousand, if you're going to this hospital, when really there are other hospitals which doctors would be more appropriate for you. And so I think that I can really say that this is something that we would not do. We would really truly search for the best place for you and meet your own, your preferences. For instance, if one of our hospital partners is undergoing renovations, when we were there, this is something that we wouldn't send any patients there unless a patient actually is very aware of this and wants to go there, because we don't want to, just because the patient doesn't have a choice once they're over there. So I can say that we really are careful about finding a place for our clients, and really as though I am going there myself. Mm-hmm. I think it's an ethical thing. I'm by profession, I'm actually a counselor and have been for 20-some years, and ethics of what you're doing, how you treat clients is a very important thing to me. And I think that's what makes us maybe stand out